So my favorite part has been this mind science event, obviously. So meeting the fellow researchers, the fellow competitors from this year, but also the ones last year, and also meeting all the mind science board, having dinner with them. We had really fun and interesting discussions yesterday with some great new ideas for future, like what to do in the future. So yeah, that has been people. I haven't really done much this kind of popularizing science before, very little. So it has been a really interesting experience to learn to do the video and like how difficult it is, the 7 minutes. So learning the process to do that, to see what others came up with, to learn from how they did it, and like basically how to kind of present your science to the lay audience. And that's, I think, super important skill. So that has been really useful and helpful, and something I've learned a lot. I am investigating how we can use anesthesia to induce dream experiences that would be therapeutic, for example, to treat PTSD. So we have some preliminary findings, or actually not preliminary, they're kind of clinical observations, where we see that when we keep, people go for surgery and you wake them up, but before you wake them up, you keep them in this pre-emergent state. And not only are people more perky and feel better afterwards, but a lot of them experience dreams. And these dreams are not just pleasant, but they actually seem to be transformative. So we have some cases where we see that patients who came to surgery had PTSD before for different reasons, and they experienced these really powerful dreams related to their traumatic experiences. That was so important to them and so meaningful that after these experiences, they actually did not have PTSD anymore. Anxiety, depression symptoms reduced, and they are like basically at least one patient really told us that it really saved my life. And now we're really taking these clinical observations to study, can we really induce dreams in anesthesia, how reliably? And then we're taking this to kind of really test outside the surgical context, can such anesthesia-induced dreams be used to treat PTSD symptoms? So that's kind of what I'm doing.